An American missionary stricken with Ebola in West Africa wore a protective white suit on Tuesday as she was wheeled on a stretcher into the Atlanta hospital, where doctors will try to save her and a fellow aid worker from the deadly virus. Nancy Wright-Bowl arrived in the United States after being flown overnight from Liberia and will be treated by infectious disease specialists at Emory University Hospital. She will be in the same isolation ward as Ken Brantley, an Ebola-infected American doctor who was able to walk into the hospital when she arrived by ambulance on Saturday. The pair is believed to be the first Ebola patients ever treated in the United States, and health officials have said the virus does not pose a significant threat to the public.
We're hearing, I don't have direct knowledge of this, but what has been announced from the people who are taking care of them, that they also have received this cocktail of antibodies which is designed to block the virus. And the reports that we're getting from Atlanta, from Emory, is that that is having a positive effect. And this is the first time that they have been used in humans. The availability of it, the amount of it, the number of treatment courses there are severely limited. So it really is nothing to compare it with, since this is the first time that they have been given to humans.
The experimental antibodies to fight Ebola were developed in the laboratories at the Scripps Research Institute in La Jolla, California. Scripps Research Institute professor Erica Ullman-Sapphire heads the group looking for the best antibody cocktail to treat Ebola.
And so the Scripps Research Institute is doing something that no one has ever done before. We have gotten all of the Ebola virus scientists in the entire world onto the same page for a single definitive study. Everybody is contributing their tools and resources, everybody around the world, to identify the single best treatment that we need to stockpile for the next time Ebola virus breaks out. So we have something for the patients and the doctors that need it. In 5 years, we're going to be able to say this virus has a cure.
Fear of being left to die in isolation and suspicion of doctors in masks and full-body protective suits is driving some patients to evade treatment altogether, meaning they can go unaccounted in the data whether they live or die. Ebola, concentrated in Africa, has killed nearly 900 people since February and has no proven cure. The death rate in the current epidemic is about 60%.